As a brain and heart doctor in India, I have seen something that still shocks me. Many stroke patients arrive at the hospital after what looked like a completely normal night of sleep. No party, no heavy meal, no major stress. They just went to bed, closed their eyes and woke up with a face that did not move, a hand that did not work, or words that would not come out. Most people worry about salt, sugar and blood pressure in the daytime. Very few think about the 8 hours when they lie still in the dark. Yet that is when dangerous things can happen silently, not only because of sleep disorders but also because of the way the head, neck and spine are positioned. My name is Dr. Hartwise. I am a cardiologist who works every day with brain and heart emergencies in Indian families. In this video I will show you 5 sleeping positions that can quietly increase your stroke risk over time and the safest way to sleep that protects blood flow to your brain. Some positions may look harmless or even feel comfortable, but inside the neck and inside the skull the story can be very different. If you are over 50, or if you already have high blood pressure, diabetes, cholesterol problems, or a previous stroke, this information can be extremely important for you. Before we begin, I want you to think about the position you use on most nights. On your back, on your side, on your stomach. Also think about your morning symptoms. Do you often wake up with a heavy head, neck stiffness, numb hands or brain fog that takes hours to clear? These are not always just age or stress. They can be warning signals from your circulation and your sleep. If you want to protect your brain and your heart while you sleep, press like, so this message reaches more people in India. Subscribe to the channel and turn on the bell. In the comments write your usual sleeping position and your age. I read these comments the way I listen to patients in my clinic and they help me decide the next videos for you. Now let us begin our countdown. Number 5. Lying on your back with one arm under the pillow. This looks simple and relaxed. Many people in India lie this way with a thin pillow and one arm tucked under the head for support. The problem is that the weight of the head and upper body presses down on the shoulder and the main blood vessels that pass from the chest to the arm. For a few minutes the body can compensate. But when this pressure continues for hours, blood flow to the arm and back to the heart can be reduced. The nerves and vessels in the shoulder region can be squeezed again and again every night. You know that feeling when you wake up with a dead arm that you cannot feel or move for a few seconds? That is not just a funny moment, it is a sign that the circulation and nerves were stressed while you slept. In a younger healthy person this may not create big problems, but in a person over 50 with stiff arteries and already narrow vessels, repeated compression can contribute to small injuries in the vessel wall. Over years this can support plaque formation and clot risk. The safer version is to support the head fully with a proper pillow and keep both arms by the side or gently resting on the chest or abdomen. If you like elevation, use a thicker pillow or a wedge that lifts your head and shoulders together so your arm does not act as a pillow. Number 4. Sleeping on your stomach with the head sharply turned. Many people who sleep on the stomach say it feels comforting. They hug the pillow, turn the head to one side and fall asleep quickly. As a brain doctor, this is one of the positions that worries me the most. When you lie on your stomach, your head must rotate to one side so that you can breathe. That rotation is then held for 6 to 8 hours. Inside your neck, there are 2 important arteries that carry blood to the back part of your brain. There are also veins that must drain blood out of the skull. Strong rotation of the neck can partly narrow one of these arteries and strain the other. In most people for short periods this is not a problem. But if you have a narrow artery, a small weakness in the vessel wall, or a tendency for clot formation, long hours of rotation every night can increase stress on these structures. There are reports of people who developed strokes or vertebral artery problems related to extreme neck rotation and poor pillow support during sleep. These cases are not common, but they remind us that the neck is not a simple tube. It is a sensitive highway for blood and nerves. If you are in the habit of sleeping on your stomach, especially with a high pillow that forces the neck into even more rotation or extension, it is wise to slowly train your body toward a safer position such as side sleeping or back sleeping with gentle elevation. Number 3. Side sleeping with the arm under the head and a very high pillow. Side sleeping by itself can be a good position for many people. The problem begins when the head is propped up on a very thick pillow and the bottom arm is folded tightly under the head. This combination can create a double hit on circulation. First, the bottom shoulder and the nerves of the arm are compressed between the ribs and the weight of the head. Second, A very high pillow bends the neck sharply to one side. This can narrow veins that drain blood out of the brain and increase pressure in some areas inside the skull. Over many nights, this pattern can contribute to headaches, neck pain, and poor sleep quality. Some studies suggest that gentle side sleeping with a straight neck may help the brain clear waste products better during the night. But that benefit depends on keeping the neck in a neutral line, not sharply bent. If you like to sleep on your side, here is a safer way. Use a medium thickness pillow that fills the space between your shoulder and head without tilting the neck up or down. Keep the bottom arm slightly forward along the body instead of directly under the head. You can hug a soft pillow with the top arm to feel supported without crushing the bottom shoulder. Number 2. The twisted spine position. This is the position I often see when people describe back pain or restlessness in bed. The upper body is turned toward the ceiling, the lower body is rotated to the side, one leg is crossed over the other, and the neck is turned in yet another direction. It feels like a good stretch for the back. For the blood vessels in the neck and spine, it can be a problem. The arteries that supply the back of the brain run through small tunnels in the bones of the neck. When the head and upper spine are twisted one way and the lower spine another way, these arteries and the veins around them can be stretched, compressed, and bent at the same time. In some people, this leads to episodes of dizziness or visual disturbance when they wake up or when they turn in bed. This position also makes it harder for the chest to expand fully. Breathing may become shallow, especially in people who are overweight or who already have sleep apnea. Sleep apnea by itself is a strong risk factor for stroke and heart disease. When you put a bad position on top of poor breathing, the brain can receive less oxygen for many hours each night. To protect yourself, try to keep your spine as straight as possible in the horizontal plane. If you sleep on your side, let both shoulders and both hips face the same direction. Use a small pillow between the knees so the top leg does not twist the pelvis. If you sleep on your back, avoid half turning the lower body to one side with the upper body flat. Number 1. The tight curled fetal position with the chin close to the chest. Now we come to the position that concerns me the most, especially in older adults and in people with high blood pressure or stiff necks. Many people curl up on the side with the knees sharply bent and the chin pressed down toward the chest. It feels safe and protected, especially when there is stress or anxiety. But this position creates several problems at the same time. When the chin is close to the chest, both main arteries in the front of the neck and the main veins that drain blood from the brain can be partly compressed. The chest and abdomen are folded, which makes deep breathing more difficult. The spine and muscles stay in a tight flex posture for hours, increasing stiffness and pain the next day. Some research shows that strong neck flexion and poor head support can disturb venous outflow from the brain and increase pressure inside the skull. In a young, flexible person, the body may tolerate this. In an older person with vulnerable vessels, this may contribute to silent, small injuries in the brain over time. If you often wake up with heavy pressure in the head, red eyes, or a feeling of internal tension after sleeping in this curled position, take it as a warning signal, not just age. Your brain and neck may be asking for a safer posture. So what is the safest position for most people to protect the brain and reduce stroke risk during sleep? The goal is simple. Keep the neck straight and relaxed. Allow blood to flow in and out of the brain without major bends or compression. Support the chest so breathing stays smooth. And avoid positions that you know trigger snoring or long pauses in breathing. For many people, that means one of two options. First option, lying on the back with slight elevation and a neutral neck. Use a wedge or two firm pillows so that the head and upper chest are raised about 15 to 30 degrees. Use a pillow that supports the curve of the neck without forcing the chin toward the chest. Place a small pillow under the knees to reduce pressure on the lower back. This position can help in people who do not have severe sleep apnea and who feel comfortable on the back. Second option, side sleeping with good alignment. Lie on your left or right side with a medium pillow under the head so the nose, spine and tailbone form one straight line. Put a small pillow between the knees so the hips stay stacked. Keep the chin away from the chest and the neck long. If you tend to roll forward or backward, hug a pillow in front of you or place one behind your back. If you have known sleep apnea, serious snoring or heart failure, you must speak to your own doctor about the best position for you. In these cases, the safest position can be different and sometimes special devices are needed. Changing a sleeping habit is not easy. The body loves old patterns even when they are harmful. So do not expect perfection in one night. Start by setting up the bed correctly with the right pillows. Lie down in the safer position each night, even if you later turn. You can use pillows on the sides to make turning more difficult. Within a few weeks, most people can retrain the body. While you work on position, remember that sleep and stroke risk are not only about posture. Short sleep, very long sleep, irregular sleep times, uncontrolled blood pressure, high blood sugar, alcohol and smoking all increase stroke risk. Think of your sleeping position as one important piece of the puzzle, not the only piece. Let us summarize. Some common positions like back sleeping with an arm under the head, stomach sleeping with strong neck rotation, side sleeping with the arm under the head and a very high pillow, twisted spine positions and tight chin to chest fetal positions can all create unnecessary stress on the arteries and veins that serve your brain. Over years, especially after 50, these stresses can add to other risk factors and raise the chance of both mini strokes and major strokes. Safer positions keep the neck neutral, the chest open, and the spine aligned. For most people, that means back sleeping with gentle elevation or side sleeping with proper support. If this video opened your eyes to something new about sleep and stroke, press like so more families in India can see it. Share this video with parents, grandparents, and friends who complain of morning headaches, neck pain, or brain fog. It may help them avoid a future emergency. In the comments, tell me your age, your usual sleeping position, and one small change you are willing to try tonight. I read and reply to comments as if we are talking in my clinic. This video is for education and does not replace advice from your own doctor who knows your full medical history. I am Dr. Heartwise. Thank you for watching. Sleep in a way that protects your brain. Take care of your heart. And remember, the 8 hours you do not remember at night can strongly shape the years you live in the future.